to be interviewing Morgan Kelly, a medical scribe in Lafayette and Crawfordsville. We will be discussing the differences in treatment for those in underserved communities. Morgan, do you want to tell us a little bit more about you?
Yeah, so I'm a medical scribe, as Sid said, and I primarily work for Franciscan Dermatology. I work for both a physician, Dr. Fetterspiel, and a nurse practitioner, Katie Neal. During my normal job, I just am in the rooms, excuse me, and I basically write down everything that they say and observe the interaction between them, the provider, and the patient. So it's a little bit about me.
Awesome, thank you. How long have you been working as a medical scribe?
I started my medical scribe training in February 2021, but I didn't actually start on the job training until about April 2021. So just over a year I've been a scribe.
Awesome. So, what do you feel like is your favorite and least favorite part about being a medical scribe?
My favorite part would probably just being like working with the providers. I've really gotten to know them extremely well and seeing how healthcare works from a different side than what a patient would see, and see their personalities and just kind of like their everyday life. I think as a patient, you go in and you don't really know how many patients they see or what their schedule's like, but the doctor I work with, he sees patients every 15 minutes. So just the quick pace and like how attentive he can be and just how much medical knowledge he has been really cool to see. My least favorite part, especially working at derm, is it can get a little repetitive. Just their people have a lot of the same issues. So, and it gets a little boring just going day in and day out, but it's still fun. So I enjoy it.
So you said that sometimes your doctor sees patients every 15 minutes. Do you feel like he gives every patient the amount of time they need, or is he kind of rushing, do you feel?
I think it really depends on the day. I don't think he tries to necessarily rush the patient, but if someone comes in and they don't really have a lot, like they only have a mole or a freckles, he probably isn't going to be in that room for very long, or acne patients, especially. He's probably only in the room for maybe 5 minutes. So, I mean, an acne patient maybe not need as much time, but I think some people don't, or they would want to have longer time with him, but he does do a thorough job, even though it may not seem like it.
So do you feel like your job allows you to be exposed to patients of more diverse health backgrounds?
I think yes. I think West Lafayette also like has a really wide range of income levels and just people in general. So he works with patients that are from all different backgrounds, all different races, kind of anything you would think of. I've seen it. In Crawfordsville, it's definitely a lower income population and more factory workers or whatnot. So it's definitely more of an underserved area, that's for sure. So it's different. It's different than West Lafayette.
Do you feel like in those underserved areas, there's a difference in the patient interactions that you see?
I think it really depends on the person specifically, but I do think the provider, it's not that they're short with them, but it's like they're more knowledgeable, so they more tell the patient what they're doing or like how to do something rather than like it be a conversation. Whereas I think if you're from a more like affluent area, or maybe you have a better job because we have all the patient's information and everything, so then they might be more they're talking to you and kind of having discussion about what you want as a treatment rather than what they think is just going to be the best and move on.
Interesting. Does provider care change when a patient is on Medicaid versus private insurance? Have you seen any differences with that?
So I think the biggest difference is if someone on Medicaid is late or no shows an appointment, I've seen the provider automatically just be assuming that they're lazy, taking advantage of the system, and that they don't really care about their health, and they're just using government taxes to fund these patient visits. And so like the next time they see them, if they actually make up that appointment, they're pretty short with them, I've seen. And they won't really work through trying to change a cream or a steroid if it's not covered by insurance. So if they prescribe something and it shows, oh, this isn't going to work, you'll need a pre-approval, the physician will often just kind of be like, well, I guess that sucks for you, and either give them a worse cream or yeah, they'll probably just give them something else instead of actually going through the pre-approval process, where someone that has like a pretty good insurance, they will do the pre-approvals, they'll have the nurses and staff like work on it and try to really get what's best for the patient.
Do you feel like in our course we talked about how on average like a provider will interrupt a patient like every 14 seconds or so? Do you feel like that interruption time is accurate, but not even so as it is accurate, but does it change based on the insurance? Like you said, he seems a little less patient with those who are on Medicaid. Would you say that in that case he would maybe interview less or interrupt more?
Yeah, that's a great question. It's actually kind of funny. I one time was a little bored with my charting, so I started counting how long they took to interrupt, and the physician on average was about 6 seconds. So he was really quick. And it wasn't like if you were asking me a question, be like, yep, So I guess I don't know if you count that as an interruption, but the nurse practitioner is a little shorter. She's probably more around that average of 14 seconds. And I would say it doesn't, we like the provider won't look at the insurance first of like on their chart. They're not going to go see what insurance they have, but usually if that person looks disheveled or it doesn't look presentable, if that makes sense, it like there's appearance a little bit different, they might be a little bit quicker to interrupt. There was one guy who came in who's he was wearing pretty baggy clothes and like wasn't very clean, didn't shower, like had a smell to him, and I presumably lived in like one of the homeless community centers around here in Lafayette, and I don't think the doctor let him say more than a few words before interrupting him but yeah. And he was on Medicaid, sorry, aid the poor, or no, care, whatever it is, whatever the insurance that you help the poor with. So yeah.
Do you feel like just being like on the inside and seeing all the different interactions, do you feel like it's a form of discrimination, or do you feel like it's more of a systemic issue kind of based off just like our healthcare system and what it's caused?
I don't think he like goes out of his way to like discriminate them. So I would hope it's not discrimination. I mean, I've talked to him and he doesn't seem like that guy. He's super empathetic and just like really wants the best for his patients. But I do think it's a systemic problem, just like kind of it's almost like assuming that the people on which one is it?
Medicaid.
Thank you. Medicaid are just like lazy, I guess. That's probably not the right word, but just aren't always trying to like better themselves. And so because he has an idea, and it's not just him, it's not just like one doctor, I've seen it in multiple and most of the ones that I work with. So, and I think because they have this attitude that they're not trying, then they're not going to put in as much effort, if that makes sense. So if you're not going to care about your health, why should I be going out of my way to like better you as well?
Definitely. I could definitely see that.
Yeah.
Do you think Medicaid affects the type of treatments that are like able to be given, or like drugs that are able to be prescribed?
Yeah, Medicaid I think is a little bit more restrictive on what can be provided. I know in orthopedics there's certain steroid shots that are given if you have like shoulder pain or hip pain and whatever. It's like kind of the first line of treatment outside of going and getting like surgery or whatever. And there's maybe 3 or 4 different versions of a steroid, and Medicaid's pretty much you have to do the bottom tier one, and that one it's effective, but it's not nearly as effective as some of the other ones. So, and then with derm, a lot of the prescriptions can be really expensive, especially if it's multiple compounds together. I've seen some upwards of like $500 out of pocket, and Medicaid, you have to go through like each step if that makes sense. Like you have to start at the first one that they say is the best, even though it's not going to do anything, and you have to work your way up. Where if you have private insurance, you can kind of get around that and get a better one. And so, yeah.
So building off of that, do you feel like you see your patients that are on Medicaid more because they're not receiving like that complete care with what Medicaid can give them?
Yeah, I think it really depends on the issue too. But and Fed or all the providers have really, if Medicaid doesn't provide it and they know it's not going to work, they're not trying to like make them do a useless thing unless they have to kind of fill those stepping stones. So they'll use GoodRx a lot. I don't know if you guys have heard of it. But it's basically a coupon that they can give out and the patient can go get the medication at basically a set cost. So Kroger is really good at it. He sends most patients there to get their medication. But there's one guy who is on Medicaid, and he comes back every 3 months pretty much for eczema because he's just like using pretty low strength cortisones and creams and stuff. So I guess it depends, but yeah.
Do you feel like the providers will ever try and do the best that they can to like get around the restrictions that Medicaid has, whether that's like expressing that something's more serious than it is, or kind of twisting like what exactly is happening in order to give those patients like the correct medication that they would need?
I think they do really try to document, and like I'm told if someone has a skin tag or whatever, and that doesn't need to be treated, but if someone wants that to be treated, like I'm told to document it as inflamed or irritated, so that insurance, like it is a problem and insurance kind of has to cover it. So my documentation does change in that way. And I think there are a lot of options for topicals and other areas. So they might not necessarily change the way I document it, but they really do try to like get around it and try to get a cream or something to treat it so the patient's not just left stranded. But I would say definitely like skin tags, and they're called seborrheic keratoses. I don't know if you guys have heard of it. It's pretty much an extra layers of skin growing on top of your own, and they can be sprayed, but they're not cancerous or harmful. So those things definitely are changed how I document so patients can get it covered.
So what do you feel like you, as a scribe, have learned from working in, I know we can learn a lot from different types of communities, but in terms of like the healthcare system, what have you learned most from working with these underserved communities?
I think a lot of patients come into the doctors more to be listened to and just like to have someone like kind of on their side. And it's super important. I think like building that relationship between the patient provider is so much more important than a lot of people like I think believe. I know I didn't really expect it. I didn't really have like a great relationship with my dermatologist, but a lot of people do like come in, they talk about their lives and they care. And this one patient he just bought or finished all of his payments for his car, and he was super excited about it, and the nurse practitioner was extremely happy for him, and you could just see like there's a great level of trust between the two. And I think especially working in those underserved areas, just listening to them, and you might not understand their problems, or you might not have had experience in their problems, but just being there and listening for and being empathetic towards them is really important and vital to like just keeping them coming back. Because if they think that you don't care about them, they're not going to continue receiving treatment. They'll just deal with it. So
Do you think that in West Lafayette and Crawfordsville we have a lot of resources for people in underserved communities as like far as healthcare goes?
I mean, I haven't seen a ton of them, and I guess I'm not an expert on it, so I don't exactly know, but I think there are some resources, but I don't think there's a lot. because there was a patient who needed crutches and they were like maybe $5 at the thrift store. So not expensive, but he did have that extra money laying around. And so there was no way for him to get it. So the doctor actually just went and bought them for him. And they have like 6 or 7 pairs. So he bought all of them for other patients in need in case. So I wouldn't say there are a ton.
One of the major topics that we focused on in our class this semester so far has been health literacy, which is just basically the ability for people to understand and communicate their health. And I was just wondering if you feel like you see a difference in different types of populations with their ability to communicate with their provider.
I would say in dermatology, the providers really try to dumb it down for everyone so that everyone's understanding what they're going through. And I think most people know what a mole is or freckles or just like eczema. I think it's pretty common. So I would say their health literacy is pretty good between all populations. I mean, there might be some that don't understand, but they really do try to get everyone on the same page. In Crawfordsville orthopedics, I think it's a little less well known about everything. So the people that are maybe have a better insurance or more insured definitely have a better understanding of what's going on than those that are maybe not so well insured. They're more just going to take what the doctor says. And if they tell them to be on crutches, they'll just go do it. They don't really care what the problem is, or maybe not that they don't care. They're just maybe not have a complete understanding of what the problem is.
How often do you see like patients having an opinion or giving input on their own treatment? Or do you feel like it's mainly just the doctor telling them, here's what you're going to do?
I would say there are definitely patients that advocate for their treatment, especially patients that have had melanoma. All the time I see them like being like, hey, check out this spot or whatnot. But I've also seen it's patients that are actually on Medicaid. Thank you. Geez, it's not sticking. They sometimes might be actually the ones that advocate more, just because they might be only going to see the dermatologist once every 5 years instead of once every other. So like when they're there, they're gonna get every spot looked at. They're gonna really kind of make those 15 minutes worth it. Whereas someone who their insurance covers a yearly check, they're gonna but it depends on the person, I think, too, and their personality.
Do you feel like because dermatology might be considered like more specialty, like you kind of only go if you need to, for example, versus like a primary care physician, do you feel like you see less Medicaid and more like private insurance because a lot of things that, I mean, besides melanoma and the big stuff, can go kind of unaddressed in terms of your skin, or do you feel like it's pretty equal?
I would say I definitely see more private insurance. Really, you're seeing Medicaid if it's like a referral, and if some like a primary physician's like, hey, you need to check this out, that's when you see that kind of insurance. In dermatology, I would say in Crawfordsville, it's kind of the opposite, because like most of them need to be on their feet, use their hands for their labor. So you're going to see a lot of those types of workers in that office, whereas someone with a private insurance might just kind of wait because they can still make a living or have an income at their more white collar jobs. So yeah.
What do you think providers can do to have more intentional interactions with people in underserved communities?
I think like just being better listeners. I think it kind of turns a lot of people away when the doctor doesn't act in an empathetic manner. A lot of patients might not return or just kind of leave the problem unaddressed, which can lead to more problems down the road. I also think, as you said like earlier, just having more resources that make it available to have access to doctors would really help the underserved communities.
when we talk about like health literacy, do you see when you see a patient with, say, a lower health literacy, do you feel like the doctor like understands that they have a health, like a lower health literacy, and they take the time to understand things or explain things better to them, or do you feel like it's just kind of like across the board the same?
Um, I feel like sometimes when people have a lower health literacy, the doctor can kind of become annoyed. Like they'll explain it, and if they're still not getting it, it almost like becomes a nuisance for them to try to like continuing to have to explain the same thing over and over again. And not that they won't take the time to do it, but if they're running behind or if it's the end of a really long day, they might not always want to just sit there and try to continue to explain something that in their mind is really simple, even though it might not be for the rest of us.
Do you think that kind of turns patients away from maybe coming back or like wanting to get treated again? Just because, like you said, a lot of people come to the doctor to be listened to. And so if they feel as though they're being annoying or aren't being listened to, they might not return.
Maybe. And I might also be seeing it from a side, like I really know these providers really well. I mean, we joke around. And so I see that sarcastic side of them. So maybe I might be reading their body language better than a patient who doesn't know them. So maybe a patient can't tell that they're annoyed, but I definitely can. But I think it might, if they notice that they're getting annoyed, I could definitely see, like as a patient, I wouldn't want to come back to that either.
Since we are all in college, do you feel like you see a lot of college students both here and in Crawfordsville because of Wabash?
Crawfordsville, I guess not particularly, but that's not my primary place. I'm only there maybe once a month, maybe a little bit more in the summer. So I wasn't seeing a ton of them. Friends at the dermatology, I would say, yeah, it's a good mix. Not a ton. I'd say the population is actually pretty like the older. There's a lot of people 75 plus that the physician sees, but they're definitely a mix of college students. They're mostly there for acne or like eczema.
When you see college students, do you think that they have like, would you say that they have like a higher health literacy or that they understand more than your average patient?
I would think that, yeah, I would say they understand most of it. I've never seen like a college student that had no clue what was going on or really wasn't picking up what the doctor was saying. So yeah.
I just had going off of that because one of the things that we learned was that people with higher education typically had higher health literacy. Have you ever come across, I don't know if you see it often, but I do work in a hospital, so I've seen it a couple of times. Have you ever come across people who are illiterate and seen a difference in their ability to communicate with the doctor about their health problems?
I've never seen someone that was like illiterate, but I've seen a lot of like the language barrier, a lot of like Spanish or whatnot, and where they need a translator. And I definitely see like the physician just kind of get me out quickly, solve the problem, move on, just because it's an extra challenge to communicate with them. So
Definitely.
Do you feel like in that situation, and then like, I mean, I guess Kelsey's situation is similar too, but like when you see either illiteracy or a language barrier, that maybe the provider becomes less focused on like the patient, like centering the patient in the visit? Do you feel like it's just, I mean, like you said, get in, get out, and they're less focused on per se making sure that all the patient's worries, concerns, needs are met within the visit?
So when the nurse goes in, she pretty much takes what they're here for. So the doctor has some idea of what they're walking into and what they need to address. And I would say in a patient that there is either just a language barrier or they're not literate, they definitely just focus on those issues that are written down, even though 9 times out of 10, there's probably about 6 more issues that the patient has.
So kind of going off of interactions with patients, do you feel like your interactions with other providers are often a little bit different based off of the level of education that you're dealing with. So I also work in healthcare, like Kelsey does. And when I used to work with doctors, I felt like my interactions with them were kind of different because I didn't have as much education as they do. So do you feel like you see that in your job also?
In Crawfordsville, yeah, I definitely am like lower on the totem pole, if you would say, with talking to the physician there, and he kind of treats it as such. And I'm just there to make his job easier. But in Durham, it's actually super, like, everyone's on the same playing field. I don't say I have any issues communicating with him or any of the other providers as well. They're super open, and they actually have been like, if I have any questions about any drugs, medications, or I'm just interested in the topic, they take the time to explain it to me and kind of give me an in-depth look. So it's been nice.
All right. Does anyone else have any other questions?
I think we're good.
Thank you.
Of
Yeah,
course.
thank you,
so much
Morgan.
for-
This has been very insightful.
Of course, glad to help. Of
Thank you.
course, bye.
Bye. I'm stopping.